I just wanted to do a brief introduction before passing over to Dr. Samir Sinha. So firstly, I just wanted to welcome you and say that with the Alliance for Healthier Communities, pleased to be part of an organization with other organizations in our health system that is part of a larger movement for community-based primary health care. The Alliance is part of the Primary Care Collaborative, which is made up of provincial associations that represent primary health care in this province. And our goal is to strengthen primary health care as the foundation of the health system in Ontario. PCC includes the Alliance, Nurse Practitioner-Led Clinic Association, Association of Family Health Teams of Ontario, Ontario College of Family Physicians, Indigenous Primary Health Care Council, and a General Family Practitioner section of the OMA. Before I go any further, I would just like to also acknowledge the land. Our association's work and that of our members takes place on traditional territories of the Indigenous nations who have lived on these lands since time immemorial. The land we call Ontario is covered by 46 treaties, agreements, and land purchases, as well as unceded territories. It continues to be home to many Indigenous people who live alongside settlers, newcomers, and people whose ancestors were enslaved across the Americas and the Caribbean. We are grateful to live and work on this land. Recognizing this in a meaningful way means making commitments to sharing and upholding responsibilities to all who now live on these lands and the land itself in our work. Let us be mindful of these commitments. Excellent. Okay, great. And now I think I would like to introduce our speaker for this session. One second. So I'd like to introduce Dr. Samir Sinha. He is the Director of Health Policy Research, and he is passionate and respected advocate for the needs of older adults. He currently serves as the Director of Geriatrics at Sinai Health System and the University Health Network in Toronto. A Rhodes Scholar, Dr. Sinha is a highly regarded clinician and international expert in the care of older adults. He is the architect of the Government of Ontario's senior strategy, and in 2014, Maclean's proclaimed him to be one of Canada's 50 most influential people and its most compelling voice for the elderly. Dr. Sinha was recently appointed to serve as a member of the Government of Canada's National Seniors Council and has been asked to lead the development of the new National Long-Term Care Standards for Canada. And I just want to welcome Dr. Sinha and all of you. Thank you for joining us. Dr. Sinha will be doing a presentation, and I will invite you to submit your questions for him via the Zoom Q&A function, which will be answered in the last 15 minutes of the program. So now that I've given you those reminders, I would just like to turn it over to Dr. Sinha.
Thank you very much, Marie-Lauren, and welcome to everybody who's joining us today and who'll be watching this presentation later at their own leisure. We're really excited to have everyone here today to just really talk about things that can really be practical ways of looking at how we can enable aging in place. So I'm looking forward to providing you with some information and look forward to having a delightful Q&A. And I want to also acknowledge again all of our partners who come together, the Primary Care Collaborative Ontario, an incredible group of organizations really dedicated to advancing primary care across Ontario and really helping to advance primary care issues across Canada. So I want to thank them for their support and for providing me this platform to provide this information as well. Just as we start the presentation, I just want to disclose some potential conflicts of interest here. When this program has not received any financial support, but it has received in-kind support through our primary care collaborative partners who are helping to put this on today, and specifically the National Institute on Aging at Ryerson, of which TELUS Health is a lead partner. I receive a number of research grants through groups like the Canadian Institutes of Health Research, the Public Health Agency of Canada, the New Horizons for Seniors program, and I'm on the advisory board for groups like TELUS, the Dairy Farmers of Ontario, a number of different groups. But in order to ensure that we don't have any inappropriate influence from industry or any bias in this presentation, we have a planning committee whose work was to ensure that these slides were unbiased and free of any inappropriate influence from industry. And that has allowed this program to be accredited by the Canadian College of Family Physicians for an educational credit as well. So why are we here today? Well, older Canadians more so than ever before are wanting to maintain their independence as they age and to live at home for as long as possible. And with increasing age comes a growing risk for falls and other medical or health emergencies that can occur in the home. And this can threaten people's long-term health and independence. And so it's this tension. We're really excited that we're living longer lives than ever before, but there's also this uncomfortable truth that as we grow older, we could become at increased risk for these challenges that could threaten our ability to age in place. So we know that older adults and their families are open to receiving advice on how to age well in their own homes, but generally are not asking for that advice from their primary or other regular care providers. And there could be a number of reasons for this. And so the goal of this presentation is really to help fellow primary care providers and others to really have this information so that they can empower the older people that they may be working with. And right now, we know that most healthcare providers are not really aware of the rapidly evolving technology solutions and what to consider recommending that can enable their patients and their families to better support aging in the place or aging in the right place. So we have 3 objectives for today. First of all, understand the risks and impacts of at-home medical emergencies. Number 2, appreciate why older Canadians want to age in place now more than ever before. And then 3, understand the practical technologies that really can enable aging in place. So for this first one, what we want to focus on is understanding that falls are really the leading cause of injury in Canada for older adults. Again, it's something that we often think about and we want to not really think about because there are things that are unpleasant. There are things that we know that can really threaten the ability of people to age in place and age independently, but they are a growing reality for many people because we know that 1 in 3 older adults will fall in a given year who's living in the community. And so this is a significant public health issue, but one that many of us are not really sure how preventable and what are the things we can do to prevent it from happening. So what are some of the risk factors behind falling in older adults? Number 1, age. We know that falls are the leading cause of injury-related hospitalizations amongst Canadians 65 and older. And it's not just about just being older, it's about the things that actually couple with age. So as we get older, we're more likely to experience things like sarcopenia or osteopenia, where our bones and our muscles become weaker. We may have more issues with impaired balance, and then other factors can all combine with that to actually increase our risk. This is why falling becomes an increasing issue as we get older. Some of the things that are coupled with things that happen as we get older are vision and hearing impairments. We know that vision problems, including cataracts and glaucoma, and hearing problems can impact day-to-day tasks that require focus and balance. And we know that 25% of older Canadians have these issues because these issues are more likely to accumulate over time and become more prevalent, especially as we get older. We also know that as we get older, we're more likely to be living with at least 1 or more chronic health conditions. And some of these conditions, including diabetes, obesity, cardiovascular and respiratory diseases, as well as dementia, all these things can actually impact one's balance and mobility as well, and so can increase the risk of falling. And then there are other external factors that can, again, combine to make these things more difficult. So again, when you have clutter or tripping hazards, poor lighting, or if you should be using gait aids, but you're not using those gait aids like a cane or a walker, for example, then these things can compound these risk factors. As well, as we get older, we're more likely to be taking one or more medications, and there's several medications that can increase one's risk of falling. This is why we see all these cumulative things coming together that actually allow that, again, falling to become more common amongst older people. In fact, we know that 1 in 3 Canadians, as I mentioned, fall each year. And the challenge is that it's not just that people fall, it's that falls can result in serious injuries. And we know that 1 in 3 falls result in serious injuries on a given basis. We know that 4 in 5 of our hospitalizations due to injuries amongst older people are because of a fall. So they're not due to principally motor vehicle accidents or other things. They're largely related to the high prevalence of falling that occurs amongst older adults. And we know that 4 out of 10 falls that are treated in hospital involve a fractured hip, for example. So these are some of the major consequences that happen. And so the goal is, if we can avoid falling in the first place, well, then we can avoid some of these negative consequences as well. The other challenge we know is that when we think about where do falls occur, we know that 50% of our falls occur at home, so in the home. And then other falls that often tend to occur near and just more immediately outside the home. So often we think about what are the things we can do, again, to prevent falling within a person's home, near a person's home, and thinking about where falls happen, what are the circumstances, and what are the things that we can do to prevent it as well. So when we think about other potential emergencies that can happen, so we think about falls that can relate to a health emergency, for example, like a fractured hip, for example, but we also think about just medical emergencies that can happen at home. So beyond falls, there's increased risks as we age of challenges like strokes, heart attacks, trouble breathing, a potential severe allergic reaction. And these things can happen, especially if someone is unable to call 911. What do you do, for example, if you can't reach the phone? We also know that consequences of memory impairments can lead to potential emergencies. So increasingly, we know that as people are aging, there's a greater risk they might be living with dementia, for example. And this can lead to injuries when while taking on daily tasks. So there's a risk of challenges with cooking. For example, someone might incur a burn while cooking, for example. They may forget to use their gait aids, such as a walker or a cane, for example, and that can increase that risk of falling. And then there's also an increased risk of wandering, where someone might just leave their house and go walking, for example, but not be able to find their way home. So again, these are all potential emergencies that can occur. And again, how do we actually help to navigate these? Then we also think about just other things that can happen. We talked about falls that can lead to things like fractures, for example, but we know that many people who also present to hospitals, for example, may have experienced a sprain or a strain that might be secondary to a fall, but it can also be secondary to living with arthritis, having weakened joints, that can lead to injuries, for example, such as falls and other things that can limit one's independence, for example. And then the other emergencies that can happen are things that are well beyond kind of our own control. So increasingly, we're hearing about wildfires that are occurring in BC. We know there can be heat emergencies during the summer, for example, winter storms, flooding, home fires. These are all things that, again, can all threaten our ability to age in place and age well at home. So again, what are things we can do to prevent these things, and what are things we can do to mitigate and better respond to these emergencies as well? So knowing that those are the challenges, for example, you might say, well, it seems like everything's stacked against me, in terms of being able to remain independent at home. So again, why are older Canadians more than ever wanting to age in place, right? We know that, there are challenges that can face us as we want to age in place, but we know that people more than ever before want to age in place. So why is that? Well, we know that nearly 100% of older Canadians recently surveyed plan to live independently in their own homes as long as possible. This is something that was heightened during the COVID-19 pandemic. People saw that there were thousands of people across the country who unfortunately died in long-term care and retirement homes. They saw what it was like when you were living in an environment where you didn't really have control of the ability to invite people to come and visit you or to provide supports. And so this really has galvanized opinion. In fact, we know that 60% of Canadians in general and 70% of people 65 and older have said they have changed their minds on whether they'd even think about living in a long-term care retirement home. So we now know that because of the pandemic, we have nearly 100% of older Canadians saying they want to stay in their own homes for as long as possible. But we also know that at the same time, 30% of Canadians don't feel prepared should they be alone when a medical emergency occurs in their home. When they actually look at the issues that I just pointed out, they're like, well, I'm not sure what I would do. I'm kind of going to hope for the best and hope that things will work out. But I really don't know exactly how I would respond in each of those circumstances, or what are the things I can do to prevent those circumstances and then respond effectively if that issue happens as well. And that makes me feel uneasy because I want to stay at home, but I'm also nervous about doing so as well. So how do we bridge that gap? So we also know that 79% of Canadians say that they have not spoken to their healthcare professionals about what to do if a fall occurs to themselves or a loved one. So I think often people are just worried about these issues and they're not really sure who to talk to. And they may not be sure if their healthcare professional may actually have the information that they need to try and adjust these issues, because maybe they're not even sure if there's anything that can actually be done. So we know that as healthcare professionals, we can provide older Canadians and their families with the right information and tools to help everyone age in place with greater confidence. And so there's a role that all healthcare professionals can play. And so that's the goal of this presentation, is to make sure that we're all empowered with the latest information, that we can give practical advice that can put people's minds at ease, but also give them practical solutions to enable aging in place. So we also know that 83% of Canadians who are older say that they're actually very open to receiving advice on how to live safely, safely on their own. So there's not really an issue about people wanting to receive this information. It's just making sure that we have the information we can provide them and we find those opportunities to do so. And this is why we advocate in saying healthcare professionals can often be the right people to raise these issues and provide the right information. So what are some of the common resources that can help enable aging in place? Often, depending on where you live across Canada, we know that often there are home healthcare services that often can be accessed, and often there are many Canadians, for example, that aren't even aware about what home healthcare services can provide. So often, whatever home care might look like wherever you live, often will include access to nursing services, nursing professionals that might be able to help with chronic disease monitoring and management. So help with managing diabetes, help with managing heart failure, help with managing other chronic health issues, wound care supports, other things, for example, that are really important for a nurse to be involved in the care of. Often, sometimes people have challenges with bathing or dressing, or maybe some other personal tasks. And this is where a healthcare aide, or what we call a personal support worker, can often be enlisted to provide some of that support as well. And often people can get the help of physiotherapists and occupational therapists through home care programs to provide a bit of therapy that can help people regain strength and balance, for example, and other supports, for example. So often there's a lot of different things that can actually be provided through home healthcare services, and sometimes even the support of monitoring technologies that can help people better manage their chronic disease or better respond when a medical or other emergency occurs. Also, when we think about home care, we sometimes don't think about what we often call community support services. So a number of agencies across the country, for example, are supported by provincial and territorial governments to provide what we'd call community support services or home support services. So there are many services that can provide support getting groceries, meal delivery, for example, like Meals on Wheels, transportation services to help people get around their communities, and social support and exercise programs. In Ontario alone, we have 2,000 free exercise and falls prevention programs available in local community settings, for example, that can actually help people prevent falls from happening by staying healthy and strong, but also if someone has fallen, can help them regain their strength and balance as well. So often there are a lot of services available, but often many people are not aware of the services that exist. One of the things that I really like through our local home health services or our home care services is the value of occupational therapy home safety assessments. So often if a person's really worried about, is my home adapted to help meet my needs as I'm growing older? I recently had a fall. I don't know how I can prevent a fall. Are there things I can do to modify my environment or other tips I can have? This is where I'll often list the support of an occupational therapist who can actually do a visit to the home. These services are often provided free through local home care agencies, for example, and can often really provide valuable input on how to make some basic modifications or some of the equipment that people can get to enable them to better age in place. So there are all these services that are often available. It's just sometimes people aren't aware of them. And so we want to make sure that Canadians are aware of the services, that they're often are available free or at a subsidized rate, and that can benefit them, as they age. So now, let's think about some of the practical technologies that can further enable aging in place. Often these are things that can sometimes be organized or supported through the services I just mentioned, for example, or would be recommended. But I just want to review a little bit more of some of the latest things that have been happening that often are available and that people may not actually know. So what are some of the supportive technologies to enable aging in place? Because sometimes people think about robots. They might actually see that in countries like Japan, there's a lot of technological investments where they're actually developing robots to actually help provide people care. I'm not going to talk about robots. I'm going to talk about things that are much more practical and much more in line with what people can actually understand and expect to get. So let's talk about smartphones, for example. There's actually, more and more people are now actually using smartphones, but not realizing how smartphones can actually be really helpful technologies to enable us to age in place. If you think about it, smartphones can be ways in which we can actually use it to provide things like virtual care and other supports. So more and more healthcare providers can provide support using video conferencing, and often that's something that you can actually access using things like FaceTime, Zoom, or other technologies where you can actually just use your smartphone to do that. For example, smartphones often will have various apps on them that can actually help with monitoring things like encouraging you to get the right exercise or recording other helpful information that can be helpful as well. And they can also be a way that, again, people often would say that, look, I'm afraid of wandering out in the community because, how can I be mobile when my phone at home is actually, a corded phone. The nice part with smartphones is you can just stick it in your gown or you can stick it in your pocket, for example, and you always have that piece of technology that you can use to call for help. So it allows people not only to be smart, but also mobile as well. So thinking about some of the things that smartphones can do, and often smartphones can also be enabled with technologies, for example, with fall detection and other things, and even geolocation services, for example, that can actually help someone locate you if you're wandering as well. So it's important to understand the value of smartphones. And one of the really cool initiatives the Canadian government has actually been sponsoring is working with major telecommunications companies, for example, to provide low-income Canadians with access to smartphones. So one of the programs that people might have heard of is the TELUS Mobility for Good program. And this is a program that gives people access to a smartphone with data and actually only charges them something like $20 a month. And again, it's a program specifically for low-income Canadians that allows people to actually get an affordable smartphone, and that allows them to better be accessing these sorts of technologies. I mentioned virtual care. More and more providers, such as your healthcare provider, might be able to provide you virtual care. They might be able to send you an email link to something that you just literally have to just click on the link, and then that activates a video screen and allows for secure chatting that can occur. And so as more and more virtual care options are being provided this way, it's important to be aware of the different options and why smartphones can be helpful as well. And then, as I mentioned, that there's the opportunity for remote health monitoring. Often smartphones, for example, and other technologies can actually be enabled so that, for example, you can keep track of your blood pressures, your heart rate, for example, your blood sugars, your weight, for example. And so either using smartphone technologies or other devices that can be set up in your own home, this can transmit important information to healthcare providers. In Ontario, we have community paramedics. We also have telehealth nurses that can provide these supports and services, for example, and that can actually feed really valuable information back to these local providers, often working with primary care providers, for example, to make sure that they have up-to-date information that can allow them to adjust, kind of medical therapies or be aware of issues that might be occurring that can actually help someone readjust their medications or their supports, help prevent a medical emergency from happening. So again, these are some of the technologies that exist. And again, it may be helpful for you to reach out when you're talking to local home care providers or your local healthcare provider to say, are there any virtual or supportive technologies like this that could actually better enable us to stay connected or me to have my care better managed as well? So we also want to think about beyond these sorts of things is other things that actually exist. So there are now, you may have heard about these things called Fitbits, for example, or smartwatches, for example. And it's amazing what these things can do. Now that with the smartwatches, for example, you have ones that can not only track your steps, which people are often kind of familiar with, but often they can actually monitor your heart rate. Some of them can actually detect abnormal heart rhythms as well. The other things that the smartwatches can also do is that many of them can now actually be enabled with falls detection technology as well. So instead of having to wear an additional device, for example, around your neck or around your wrist, one of the things like the Apple Watch that people are quite familiar with, it actually is enabled now with an app, for example, where you can actually use it for falls detection and emergency response as well. So this is kind of the exciting things that we're starting to see emerging of technologies, and ones that, for example, not only do you have a watch that can actually tell you the time, for example, but it can also help monitor your health conditions, and it can also be used to help detect falls or other emergencies and really access help quickly. So often there are really cool things that are being developed, but often people are just really unaware of the technologies that might be out there that actually can help. Some of the cool smartwatches as well, they often have geolocation services. So for example, if you have a loved one who has dementia, for example, you might just give them this watch. They like it because it's just a watch. But if they go wandering, for example, you can easily locate them and understand exactly where they are because that watch also has a GPS location system built within it as well. We also know that people are increasingly getting smart home devices. So we hear about these devices to make your home smart, to regulate temperature and other things. And often there are devices that are now being developed, for example, that can actually detect changes in blood pressure, changes in heart rate, also changes or the risk of falling as well. So there are also there are other devices that are being developed, for example, like medication dispensers. So things that for people who might have trouble remembering to take their medications, there's some patients who have these devices, for example, where it'll beep, when it's time to take a medication, a person just kind of presses a button, for example, or the device just simply at that appointed time will dispense exactly the medications they should be taking that time. So if they have memory problems or they're forgetting to take medications, or they might not reliable to know how or which ones to take, this is something that can help control the medication dispensing and allow them again to safely take the right medications at the right time. The other thing are what we call personal emergency response services. So these are things that that people again can wear around their neck, for example. They can wear them around their wrist. They can also have them built into smart watches now as well. And these are devices that Canadians are increasingly using, because not only can it actually detect a fall, for example, but can also be used very quickly to locate help. And the way they're different than just simply calling 911, for example, is that if you push the button, or sometimes it can actually detect if you've actually fallen itself, you'll get a call from a local service. And often that local service will already have your preferred contact information. So you might say to them, call my sister, call my brother, for example, and they can actually organize that help and rally that help for you. Or if they don't hear you responding or they're concerned, they can automatically get emergency medical services involved. So people often like this because they often know that, again, depending on if there's an urgent issue that happens at home, there's a way that it can detect an issue that can happen, or you can actually call it. And often these devices are not just for people living at home, but often they can go out in the community and they can use these devices in the community. So again, if there's an emergency, they can actually use one of these devices as well. So these are often called PERS, or personal emergency response services. So again, a lot of different things that are available. But again, often people are just not aware of how quickly technology is developing and how practical a lot of these technologies can actually be. So to understand PERS a little bit more, for example, again, that when you think about these devices, for example, these can actually be electronic hardware, as I mentioned, that actually can be connected to an emergency response center, and it can dispatch help depending on what you actually need. As I mentioned, these can be worn as a pendant or a smartwatch or bracelet, and again, with a help button, for example, that you can initiate help with, or sometimes can actually just call you when it detects that an emergency has occurred, and then allows you to get the help you need. As I mentioned, again, that some of the advanced features that these devices can have is that falls detection, so it can tell if you've had a fall, or that, again, that GPS tracking available. And some of them allow two-way voice interaction if a user can't actually reach a phone. So often I've had patients, for example, who've fallen, for example, they've been in another room, they've been away from their smartphone, for example, or they might have a landline, they can't actually reach it, but then their device can actually start talking to them, and they can actually push a button, for example, to say, to activate help. And so it's not dependent on them being located close to their phone. So it's that extra layer of protection, or something that they've been able to access when they're out in the garden and they've had a fall, or in some cases, if wandering has occurred, for example, again, a way that help can be rallied very quickly. So we know that a British Medical Journal study found that 82% of falls have often occurred when a person was actually alone. So we often hope that if we do have a fall, there'll be someone, next door, for example, or there'll be someone, in the house who will often find us. But we often know that the majority of falls actually occur when people are alone. And it's amazing how many stories I've heard from my patients when they've actually fallen, for example, because we know the stats say that 80% of those who fell were unable to get up after at least one fall, for example. So again, this may occur when you're alone. This may occur and you're unable to get up, for example, unable to crawl over to a phone or to a device, for example. And then we know that 30% of people have lain on the floor for an hour or more before they were able to get help. So some people tell me about they're banging on the floor, they're yelling, they're screaming, they're hoping that people will actually come across them, for example. And an interesting study that was actually published showed that people who were on the floor for an hour or more, there's a high mortality rate within a year for those folks who've actually, unfortunately, laid on the floor for an hour or more as well. And we know that those who, 50% of those in one study who've laid on a floor undetected for more than an hour died within 6 months of a fall. So again, this is why we always want to make sure that people can access that help in these sorts of emergencies, because I think a lot of people say, well, don't worry, if it happens, I'm sure someone will find me. But again, you can always imagine that when many people are living on their own, they may not have people to support them. Again, how do they access that help? So we know that when you think about the impact of these personal emergency response systems, why could they actually be helpful? Well, we know they can gain faster assistance in an emergency and preventing additional complications, right? So they might not necessarily prevent you from actually having a fall, for example, but they are actually going to help people get assistance that much more quickly, and therefore prevent those additional complications that can occur from lying on the floor for a long time. They can extend the time users are able to remain living at home. Often people actually feel more comfortable living at home. Their families feel more comfortable with them staying at home on their own because they know that there's a quicker way that they can access help should they need it. It's because it can actually increase a user's sense of security, that reassurance that that in case of emergency, I can get help. There's an easier way to access help, for example. And it can also reduce anxiety about falling. Again, we may not be able to actually prevent a fall from occurring in some cases, but again, we can reduce anxiety about falling and increase confidence in performing everyday activities. It's a way to manage unpredictability if you want to think about it in one way or the other. When people actually say, kind of how much do these things cost, I hear that they're quite expensive. So there's a number of different kind of devices available out there. So there's a number of common ones. I've named here some of the four most common services that exist across the country that actually exist, for example. And again, prices vary and services vary. So it's good to kind of, again, inquire, learn around this. But when people find out that these supports can be as cheap as $15 a month, they realize, wow, $15 a month for about 50 cents a day, I can buy a lot of peace of mind. And of course, the more fancy devices you want, the more you'll actually pay. But again, these can actually be incredibly affordable. But a lot of people often might recall, if they've inquired before, how these things sometimes can cost $70, $80, $100 a month. The prices have significantly come down. And so this is why I often recommend this to people who may be wanting to live at home, age in place on their own, but are unsure about the technologies they can use beyond that as well. So what are some of the barriers to implementing or encouraging the use of some of these devices or technologies? Often people think about the costs. They're just saying, like, I heard it costs a lot, but they might not be aware that costs have significantly come down, and that these things, that there are a lot more options available that make these things more practical. Some of the features may not be as effective in older adults with moderate to severe cognitive impairment. So again, if you have quite advanced dementia, it may not be practical to have someone, be wearing a pendant or a device, for example. So some of the features may not be helpful, but some of the features can be really, really helpful, such as the devices that actually have wandering technology, for example, or the devices that can be more innocuous, like just, putting on a smartwatch, for example, where people don't mind that and therefore don't have to be reminded every day to put on their pendant, for example, that way. Sometimes language and geographical barriers can be challenging, right? So depending if you live in a region where they may not actually have a service like this available, just due to geography, some of these services are not available in certain rural and remote communities, although availability of services is increasing, and that can be problematic as well. And sometimes these services are not available in languages other than English as well. So these are some of the opportunities that various providers are working on. But again, these can be practical barriers to thinking about them. And then some people have concerns about their data privacy, right? They might say, well, wait, who's getting this data and what could actually this be done? But again, many companies are being incredibly transparent, say that, look, this information stays between you and the company. It doesn't get shared with other people. But it's important to ask about these because these are some of the things that people get worried about. And these are things that need to be thought about. We also just know that many primary care providers are just really not aware about these devices, about how the technologies have changed, how they can be practical in more ways than one, for example. And often people may not just be aware about these, they may not have the knowledge to feel confident about talking about these devices and these different solutions. And often it's time to talk about these things in addition to trying to deal with all the other issues as well. And often there's stigma around these devices. Some people say, I don't want that, right? Because that's what old people get, for example. I don't want to use a walker. I don't want to use a cane. I don't want to think about those issues. And people often believe that they wouldn't benefit or wouldn't require a device like this, for example, or even some of the other technologies or supports, like just getting some home care supports and OT home safety assessment. So I always try and bring this back to always asking to my patients what matters most to them, and really talking about the value of saying this is actually something that can help you stay healthy and independent. And often with many of these things, you can often try them, and if after a few months it's not useful, you don't like it, you can cancel and not have to continue to pay any further. So often now, with the greater flexibility, it's often reasonable just to even give things a trial and actually see how useful they can be. So we know that, as I mentioned before, Canadians are more determined than ever to age in place, and COVID-19 has led to 60% of Canadians, as I mentioned, to change their opinions about where they want to live. People are more adamant than ever before about wanting to stay in their own homes for as long as possible. So how can we enable? How can we start enabling aging in place with your patients, for example? Again, really just talk about it. Patients and their caregivers are open to receiving advice on how to live more safely on their own, but are often not sure who can help them better understand their options to enable aging in place. So again, often I know primary care providers and others are often quite overwhelmed with trying to communicate a lot of different things, like the importance of vaccinations, the importance of managing one's health conditions and preventing them as well. And so sometimes this is an issue that can kind of fall off the radar. But again, it's important that that everybody start being more comfortable with talking about these things and exploring and knowing that there are options available for them. And again, what are other ways to enable aging in place? Again, thinking about assessing and preventing risk for falls or other hazards. I always say that if you've had a fall in the last 6 months, you're at significantly increased risk of having a future fall. So what are the things we can do to prevent that, right? So things like occupational therapy, home safety assessments can be really useful. Getting involved in an exercise or falls prevention program. We know that there's so many things that if you've had a fall, there are many things we can do to prevent a future fall from occurring. And so this is where it's really helpful that if you've had a fall, let's ask about them and let's tell your healthcare provider, because often there are things that they can actually help enable for you to help prevent that fall from occurring. We encourage people to stay active. We remind people that the exercise guidelines for all Canadians recommends 150 minutes a week. That's for younger and older Canadians. And by staying physically active, going for walks, participating in the exercise programs, potentially even going to the gym, you can strengthen your muscles, you can increase your stability, you can improve one's mood, prevent dementia, and maintain one's overall health status. So exercise is really important, especially as we age. It can really enable aging in place. We've talked a lot in this talk about technologies and ways to stay connected. And so you can think about digital and non-digital supports and services that can help you keep connected, to your loved ones, to your family members and your friends. Connected with your healthcare providers, for example, using smartphone technologies and other things, and also thinking about other practical technologies that can enable people to age better at home with that greater sense of security. And finally, open communication. Often I just say that, look, the reality is that aging can be challenging. It's not for the faint of heart. Things can happen, and we often don't want to think about emergencies or other issues that can happen. But we all know in the back of our mind that these are things that can threaten our ability to stay at home. I don't know any patient that's excited about the possibility of falling. They're terrified of it. In fact, the number one fear in older adults is actually that fear of falling. So how do we promote open communication about this to help patients feel comfortable and confident about enabling their own aging in place solutions, even after some solutions are implemented and as their health evolves? So sometimes people say not interested, but often when I'm meeting with my patients, I'm always saying, hey, maybe this is a time we revisit that thing, because maybe this is a time when now it'll be more useful. And so always being open to say, even if someone dismissed an idea, they might be more ready and open to it later on. So always keep that open communication going, so that, again, when it's the right opportunity or it's the right time, we can enact that opportunity. So what are my bottom lines? Number one, we know that aging in place is a top priority for every older Canadian. And so though that we're at increased risk for experiencing injuries, medical and other emergencies that might threaten that, there are things that we can do. And we know that older adults and their caregivers can benefit from a number of cost-effective at-home technology solutions. These are things that I mentioned can help people stay connected, but also maintain their independence and improve that sense of security. But they're not having those discussions with their regular healthcare professionals, to learn about them, to prepare themselves. And often there are ways that older people can empower themselves to learn about these things. And I'm hoping that this talk has been a way to do that. And I think armed with a better level of knowledge and awareness of aging in place enablers, I think healthcare professionals can better engage their patients and their families about possible tactics and technologies to support aging in place with greater independence and peace of mind. And I hope that for maybe some of the older viewers who are watching this as well, that again, they can share this information with their colleagues and their families as well, so that they can determine how they want to plan the supports that they think will enable them to better age in place. So I'm going to stop there, and I think we have some time for questions. So I'm going to leave it at that and let our team go from there.
Awesome. Thank you, Dr. Sinha. That was a very great presentation. I think I learned a lot about aging in place. And we've had a lot of questions in the Q&A, so I'd like to get to that. There's also been great chatter in the chat, and I think it's great that we've had attendees from all across Canada speaking to their specific experiences. I'll start with Roberta Bergman's questions. They're about technology for people with disabilities, so accessible technology. People with limited mobility or dexterity, for example, cannot use smartphones. Roberta was wondering if there are any phones for individuals who use only one hand with limited fine motor control. Like, for example, are there any mobile phones with like real actual keyboards that can be managed by someone who can only use one hand?
That's a great question. So even I'm not the expert when it comes to these technologies, but I think, again, it's important for us to appreciate what are the limitations that Canadians can face, for example, because we know certainly that if people are limited, kind of with their physical abilities in terms of, I can't just pick up a smartphone and dial that. I have patients, for example, who are having worsening macular degeneration and glaucoma. It means they just can't visualize things. So this is where I like to say to reach out to local organizations that might be working with you. So I often recommend the Canadian National Institute for the Blind, for example. If you have arthritis, you might reach out to the Arthritis Society, for example. And again, if you have a specific illness or disability, if you're living with MS, for example, often there are organizations that might have a better handle on specific technologies, or through their networks, they may know about devices or different services. So I can't give a specific answer to that type of technology that person was asking about, but I certainly know that sometimes going to one society, often my patients are coming back when I've asked them to kind of do that. And I'm like, tell me what you learned, because then I can share that with other patients who might be in the same situation.
Awesome. Thank you so much. And there's another question as well about practical ways for help and for balance and mobility. So I think it's R. Kelly has written, I'm 75 and I study and participate in online Zoom classes for Tai Chi, Tai Chi Chuan. If you could please discuss this as a practical way for aging in place, or that would be helpful. Yes.
So that's amazing, because right now, one thing that the pandemic did was it really restricted people's ability to get out in their community and go to some of these local classes. The great thing was that a lot of community agencies responded by taking their programming virtual, which means that a lot more people who might have mobility issues or trouble with transportation can access a lot of these free virtual classes. Tai Chi is one of the best evidence-based exercises or martial arts. It's actually a martial art that one can actually do to really improve balance and strength. And so this is actually a really good kind of thing that people can do. And again, as I was talking about it, the nice thing is, if you don't have a computer, you can't afford a computer, you can't afford internet, and you're low income, for example, there is now these programs like the TELUS Mobility for Good, or other ones that can give you a smartphone with 4 gigabytes of data that can allow you to actually again, access the internet, do online programs, and through your smartphone, you could participate in an online Tai Chi program. So that's a great example of one of the programs. There's things like chair yoga. There's other things. I know the Parkinson's Society runs a Dancing with Parkinson's program. There's lots of these different things that have been shown to actually show that these things can improve strength, they can improve balance, they can significantly reduce falls. So again, any type of exercise that you want to do is good. And I'm glad that this person was able to find an online program they could access, but reminding people that there are often ways in which we can encourage and support people to access more online programming as well.
Awesome. Thanks, Dr. Sinha. And there's a couple other questions about the various services that you mentioned and the different ways. Someone had asked, are there groups or contacts locally that can coordinate all these services in support of the older person living at home?
Yeah, so it really depends on where you live, right? So again, every province and territory in Canada organizes services kind of in different ways, for example. So if you're not really sure how to access, usually, in Ontario, for example, you can actually self-identify and call up the local home and community care service office, for example, and say, I think I need an OT home safety assessment, or I think I need care, and you will get assessed for the services that you might actually need. There are often a lot of community or charitable organizations, community support agencies that, again, you can self-identify and say, what are the services you might have available? If you're still not sure how to access, try and work with your local primary care provider. Sometimes primary care providers may be working in teams. They might have social workers or other community health providers, for example, who are with them that can often link you with those services and those programs as well. So again, often think about who's in your care network and team, and just be open and say, look, I know I'm here to see you for my diabetes, but do you know about any of these other programs? Because often people do. It's just a matter of just being open and talking about, hey, what are the opportunities that I can actually access? So there are often different access points. To be honest, it's not really well organized. It's a big bugaboo of mine for people to easily know, I just call this number and I know exactly who to call and get those services coordinated. But again, your primary care provider can be a really good point of contact to at least put you in touch with someone or know how to start connecting you with some community services that might be available.
Awesome. Thank you so much. And I think you've answered the next question I was going to ask. Someone was talking about being self-referring or having their primary care physician, primary care clinician look after that. So I think you've answered that. The comment was also that there are many unattached citizens with no physician. And so good to know that people can self-refer if they can find the information themselves through community. That's great. Okay.
And some of these same programs too can often, also coordinate you access to finding a primary care provider as well, right? So again, we have a program in Ontario called Healthcare Connect, for example, so that if someone is without a primary care provider, they can be connected to a primary care provider, because it's really important that every older person, if they have the opportunity to get a primary care provider, try and find one, because they ultimately can be your quarterback to try and help you navigate both your health issues, but also some of these other issues that can enable one to age in place. I know that we have massive primary care shortages across the country, but we often do have primary care providers still in various locations who are accepting new patients, but people often don't know how to connect with them.
Mhm. Good point there. Good point there. And I know you've talked about community supports as well. Janice is asking if there are any options for home care when someone does not have the extra money to afford the support.
Yeah, so we know that right now there are a lot of folks, for example, who can't afford additional private services. We know there are a lot of low-income Canadians, for example, who don't have a lot of extra dollars, to be able to provide home supports. This is why I've really been working and advocating over the years for more affordable services for low-income Canadians, like low-cost internet. Now, people, older people who are on the guaranteed income supplements, that's close to 2 million older Canadians who are what we call low-income Canadians, can now get fast internet for as low as $20 a month. That was recently announced as well. So TELUS, Rogers, Shaw, like all these major providers are providing these services. I talked about this program called TELUS Mobility for Good, and I think the other organizations provide this as well. It's a great way to get people access to telephone communications, because I have patients who can't afford a phone, and so I've been able to connect them to getting a smartphone using these services, and they didn't realize it can be, these are services that are being provided and heavily subsidized for low-income Canadians. And then again, those are some ways in which people can get access to technologies that can help them enable aging in place, but often sometimes a way to access other care and support, and such as home care, government-funded home care, and other services. So a number of these services are still offered for free. The challenge, like home care services, is just sometimes people aren't aware of what's available for them and how to access them. So there are services available, it's just not always obvious. And so these are some of the things that I've been really proud to advocate for, to make sure that low-income Canadians can certainly try and navigate and still be able to age in place through services that are available and that are low cost as well.
Okay, thank you so much. And so I think we've got like 6 minutes left. I'm going to try to move through some of these questions. There are quite a few, and I see the chat is very busy. There are some questions about the falls. You had mentioned this in your presentation. So I think Joe is asking, what is the cause for the mortality associated with people who lay on the floor for more than 1 hour? Can this be monitored post-fall?
Yeah, it's a great question. So sometimes people who've fallen on the floor and are on the floor for longer than an hour, they might actually develop challenges, for example, where when you're laying on the floor, you might have muscle injuries, for example, and that breakdown of the muscle can actually cause kidney injuries and other issues as well. And the longer you're on the floor, the more it can cause other issues to happen within one's body. That extra stress can then lead to heart attacks or other issues. So this is why when people come into the hospital and they've been laying on the floor sometimes 8 or 24 hours, they're quite ill in that way. So and sometimes those issues that have happened cannot be reversed. That's why it's important that if one falls, that they get help as quickly as possible to enact that, get that support, because sometimes those issues that land them on the floor and don't get treated quickly can actually cause serious long-term health consequences as well.
Okay, thank you. And we had a question from Amanda, who's a physiotherapist. So she's looking to address the needs of older adults in underserviced areas. This is along the lines of falls as well. Are there resources or services available to healthcare providers interested in initiating a falls prevention program for older adults? She mentions that it's difficult to navigate the subsidized funding that's available.
Absolutely. So again, even in rural and remote settings, there, often you can still receive some government-funded home care services, which could be the support of a physiotherapist. It could be the support of an occupational therapist to do a home safety assessment, a physiotherapist who might be able to create an in-home exercise program, for example, or suggestions. And now the nice part is with a lot of these virtual falls prevention programs that have been developed, again, it's about connecting people with the technology. And we talked about subsidized programs now to get people access to internet or to a smartphone that can get you into an online class that can allow people to actually do some of these programming from their own homes. So even in rural and remote communities, some of the great things that have happened by taking more things online and making things more accessible, and some of these more subsidized internet and phone capabilities now are allowing more people to access some of those supports that can leverage the great work that physiotherapists in rural and remote communities can actually do. So those are just some of the suggestions that I would recommend, thinking about how one can build out or access services, because often some of these online programs, they don't care where you're tuning in from. They're just excited to have people tuning in and participating as well.
Awesome. Thank you so much. And a question from Lynn Stewart. Our community is attempting to share prescription to move, in quotes. Doctors give their patients a prescription to do yoga, Tai Chi, etc., but it has been difficult to roll out. Do you have any suggestions?
Yeah, you know what? Honestly, it's just kind of really trying to make sure that people appreciate the benefit of exercises and the reason why exercise is important. So I'm not sure what the specific difficulties have been in rolling out their program, but often people won't do things, like people don't do things unless you tell them about things, right? And when I emphasize to my patients, hey, do you want to prevent dementia? Do you want to prevent falls? You know what? You should be getting 150 minutes of exercise a week. Then they'll say, Dr. Sinha, what's the right exercise for me? And I'm like, the one you're actually going to do, right? So you don't have to go to the gym and lift weights, for example. You don't have to be a marathon runner. If you like to go for a walk, amazing, right? And if you like to do it one big long walk once a week for 150 minutes, great. If you want to do 30 minutes a day, brilliant. I don't really care as long as you're moving, and appreciate that you moving keeps your brain healthy, actually protects it from dementia, can reduce the risk of falls. And when people understand that, they're more highly motivated. And when their own primary care providers actually mention that this is actually part of your healthy aging prescription, people are more likely to do that. That's why it's not about just a fancy technology. It's about thinking about all these things that when you put them together can really enable healthy aging.
Awesome. Thank you so much. We have like 1 minute left. I just wanted to squeeze in one more question since you mentioned running and or walking. With normal usage, how often should running shoes be changed? I.e., traction wearing on soles may cause falls.
Yeah, so you want to take a look at your footwear. If it's fallen apart, that's not a good sign. If the tread is wearing thin, that's not a good sign. Some people say, depending if you're getting regular exercise, you might want to replace your walking or your running shoes at least once a year. It's sometimes more frequently, depending on how busy and you are in terms of using your equipment, for example. But again, these are great pieces of advice you could ask a physiotherapist, or if you're working at, or if you're at a local running shoe store, they can give you some more guidance on kind of what would be recommended. But certainly, if they look like they need to be replaced, they probably do.
Awesome. Well, thank you so much, Dr. Sinha. We're at time. So just want to thank you for your presentation and thanks everyone for joining. I hope that you enjoyed this presentation. Have a great day.